I'm doing an article called Musculoskeletal Loads and Ergometer Rowing. It was published in the Journal of Applied Biomechanics, and the authors are shown there. So the first thing we should probably address when we're talking about this article is what an ergometer is. An ergometer is the term used to describe an exercise machine with an application that measures work performed. But in this case, we're talking about an indoor rowing machine. By show of hands, how many of you have used one of these before? Okay, that's a decent amount of you. Have any of you ever been trained in how to use one correctly? All right, like one or two, right? So that's exactly what this article addressed. So the authors of this study wanted to know whether non-rowers who practice ergometer rowing were at risk of musculoskeletal problems just as the rowers do, the competitive rowers are. So this is important because ergometers are found in most gyms and fitness centers around the world, but many people have little to no instruction on rowing technique. People use rowers for cross-training to avoid overuse and as an alternative full-body workout. So the main background for this article was done by Tights in 2002, which concluded that ergometer training is a common cause of back pain and injury in competitive rowers. So this article wanted to know whether non-rowers were at a similar risk. So this is the premise for the study. There wasn't a really true hypothesis because the variables weren't directional, so there was a purpose. The purpose of this study was to quantify the differences in whole-body kinematics and kinetics of competitive rowers and non-rowers during ergometer rowing. Thus, the goal was to determine whether non-rowers were at similar risk for injury. So this study was done at a university in Japan. 5 members of a varsity rowing crew team were taken, and 5 physically healthy non-rowers were also taken from the same university. An important fact to know is that they had comparable anthropometric data and physical fitness. So they had very similar heights, very similar weights, and very similar sized legs and arms. This is important because you'll see with the results that they didn't normalize the data to body weight. So what they did is they had the 5 rowers row on an ergometer machine until they reached a speed of 26 strokes per minute with maximum effort. Once they reached this speed, they collected data for 7 seconds, or 2 full strokes from drive to recovery. To collect data, they first collected kinematic data using a position-sensitive detector camera system. They had 10 infrared emitting diodes on the right side of the body and 4 were placed on the ergometer. They measured handle tension with the use of a transducer placed between the handle and the chain on the ergometer. They also measured foot reaction force with strain gauges and a force plate in the right foot cradle. EMG data was also collected from 7 muscles on the right side of the body. One limitation of this study was that with the force plate, it wasn't actually 3D, it was 2D. So you got the vertical forces and you got the anterior-posterior data as well, but there were no medial-lateral forces. So they were assumed to be 0. When calculating the joint moments and muscle tensions for this data, body segment parameters were estimated using regression analysis from a previous study, and joint forces and moments were calculated using inverse dynamics. So this is one of the first graphs, and this shows the external forces on the handle tension and on the foot cradle that was talked about before. And you notice that the higher forces are on the experienced rowers. The experienced rowers on the left, non-experienced rowers on the right. There's more variability with the non-experienced rowers, but the actual with a significance of p-value of 0.05, the only significant data was the anterior-posterior foot reaction force data, and that experienced rowers applied more force than non-experienced rowers. So this graph is talking about trunk and knee motion. It's talking about maximum knee flexion moments, and you can see it's significant at a p-value of 0.02, that experienced rowers had a maximum knee flexion moment greater than non-experienced rowers, while non-experienced rowers have a maximum lumbar flexion moment greater than that of experienced rowers. This is the EMG data. They included the rectus abdominis, the lumbar, and the vastus and the hamstrings. And it basically tells you that experienced rowers and non-experienced rowers basically row with the same kinematic and kinetic data. The only significant here is if you look at the vastus, or the quadriceps, and the experienced rowers have a higher force there than the non-experienced rowers do. And here is just the joint contact forces. And this basically tells you the exact same thing that it said before, where experienced rowers use their legs more and the non-experienced rowers use their backs more. So in conclusion, non-rowers and rowers are capable of rowing an ergometer with generally similar patterns of kinematic and kinetic data, and experienced rowers generate higher quadricep forces. So one interesting point from the data is they made a ratio of the peak vastus force, the quadricep force, to the mean peak erector spinae force, and this is just your back. And 1.52 was the ratio for the experienced rowers, and 1.18 was the ratio for the non-experienced rowers. And if you look at this, and maybe a future study from this would be to determine whether injuries in non-rowers are actually more prevalent than in experienced rowers because these forces are so different. That's pretty much it.
Talk about greater forces in, I think it was the handle and the foot area in the experienced rowers. What do you think that's due to? Is that, do you think they're actually stronger, or do you think, is that how it's
I think they're probably, well, I don't think they're actually stronger because they said the people that were non-rowers had very, very similar physique and probably trained in different sports. But I think they're just more comfortable with knowing how to row. You're going to exert more force when you know exactly what your technique is, know exactly what your timing is, and when you're comfortable with the equipment. So I think that's what that is. And if you saw it, there's more variability for the non-rowers. There were like 3 different peaks. I can go back to it. Because they made an average. So if you look here, like there's 3 different lines. So it's definitely more variability than with the experienced rowers. So.
I felt like this study really used extremes, like competitive rowers who actually get on the water and will compete to row, and then people who rarely row, just kind of row every once in a while. How do you think this study would change if you use some intermediates and maybe uses only an erg and not on the water, but is still really intense in that?
Well, I think it would probably be even more similar data because they didn't find too many differences. They basically concluded that people who row a lot and people who are non-rowers use basically the same forces with the exception of the lumbar forces and the quadricep forces. So I'd expect higher quadricep forces and lower lumbar forces in the people that are in the middle. So it would probably be even less significant than this study.
I know that it said like in the article that like the data was going to be like estimating the potential risk of injury, but it never really said anything like after that. What do you think, like comparing the experienced rowers and the non-experienced rowers, since they said injury was so prevalent in the experienced rowers, like how do you think that would compare? Like do you think do you think it was, yeah, like what do you think about that?
I'm not really sure, just because I think a lot of it could probably be due to overuse with the back than the experienced rowers, because I think they have better technique, because if you saw they use their quads a lot more than their back. So maybe in the non-experienced rowers, if they were to do the amount of hours and the amount of training that the experienced rowers have done, I think they would actually show more injury because they're using their back more than their quads. And that's probably going to put the stress on the lower back and increase pain and increase injury.
What types of back injuries do you think you're going to see with the inexperienced rowers?
I mean, probably a lot of muscle problems. Maybe it depends on what you use. Maybe uneven back problems. Maybe stress fractures if you're really going to get that far.